Good afternoon. Thank you for joining us for our briefing today. We'll start off talking about something that's been a very important part of our response to COVID-19, and that is testing. And the latest important development on testing in our country, President Trump announced that every state will begin receiving weekly allocations of a rapid point-of-care test that we can use here in Tennessee, as we think is important. Tennessee will receive our first shipment next week. That will be about 150,000 tests. And these are, as I said, rapid tests. They're point-of-care tests, and they will be used, importantly for us, in the continued reopening of schools. There will also be opportunity for these to be used in the continued strong approach that we've had toward protecting the elderly in nursing homes and long-term care facilities. So we just received notification of this. We'll be receiving our shipments, and we'll be developing a plan for distribution over the next several days so that we will know how to use these tests most effectively in our state. But it's good news for us. It will help us in what we believe is a continued effort of testing. We've been We've had a strong testing approach in this state, and we think it's fared us well, and we now have the opportunity for more testing. I said we would be using it for opening schools. I want to mention a little bit about what I did yesterday, which was visit Sterke Elementary School in Knox County and Anderson County High School. Let me just say, it is a particularly challenging job right now for teachers, for principals, for superintendents, for educators, for those working in schools, administrators. It's a tough job, but they are rising to the challenge. I saw it firsthand yesterday. I got to visit with kids in kindergarten, got to visit with kids all the way up through high school, talk to them about their experience of in-person learning. I talked to kids online in a virtual classroom. I saw teachers teaching virtually and teaching in person, and I saw teachers actually doing both, teaching a classroom in person while there was a virtual class going on at the same time. I just have to say that I'm very proud of the work that's being done in our schools. These couple of schools are an indicator of what's happening all across Tennessee. We all know, and we're knowing with increasing clarity, that in-person learning is very important, particularly as we evaluate learning loss. And we also know the value of a teacher and the role that they are playing as we assess education all across the state. So we had a really good visit yesterday, and I was really proud of what I saw. I want to talk next about the state of emergency here in Tennessee. So we're approaching the end of the month, and we've been evaluating our state of emergency. All 50 states in this country right now are under a state of emergency and are continuing those. We've been under a state of emergency for 7 months now. It's allowed us to respond more rapidly because of the ability to lift restrictions and regulations. It's allowed us to have access to federal funds for the programming and the efforts that we think are most important in our state to fight the spread of COVID-19. It's also allowed us to keep our healthcare capacity stable because we are allowed, because of the state of emergency, to lift some regulations on healthcare providers so that we can keep our capacity stable. And it has remained stable throughout the pandemic, and we're very grateful for that. So in spite of the fact that we've had a state of emergency, I think that we have taken one of the most targeted approaches to the pandemic in the country, eliminating the need for prolonged business closures or extended school closures. We were one of the last states to shut down, one of the first ones to open up. And it's been very important to me that we take a targeted approach that's not overreaction, but it is actually a reaction to what's happening on the ground. And that's been our approach. So as our national state of emergency continues, I'll extend Tennessee's state of emergency for another 30 days. I do want to highlight that while we're extending that state of emergency, we are removing all business restrictions in the 89 counties that are controlled, for which the health departments are controlled by the state. It's also important to remember that while we lift all business restrictions, we don't remove the affirmation to business owners that they should follow safe practices. We've updated the Tennessee Pledge. That will be republished this week. It's updated, refreshed, to provide continued guidance to businesses on how to keep their employees safe, how to keep their customers safe. We need to continue to all do the things that will keep us safe, and including our businesses as we lift those restrictions. There also no longer will be any restrictions in those 89 counties on gathering sizes. Gatherings are not one size fits all. It's become unnecessarily complex to keep those restrictions in place. And really, after 6 months, Tennesseans have learned how to assess risk and how to take the right steps to protect themselves and those around them. It's also important to remember through these restrictions being lifted that it's important that people wear masks. Masks fight COVID-19. We know that. We want to encourage Tennesseans to continue to do that. As such, we will continue to give county mayors the authority to impose those restrictions as they see fit in their communities. County mayors have been good stewards of this authority, and it has been a part of our strategy to provide local decision-making throughout this pandemic, and we'll continue in that way.